Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of 89.3 Lakes FM and Civic Center TV. We're also, as always, on Civic Center TV and Birmingham Area Municipal Access, both of those channels on Comcast Channel 15 and AT&T Channel 99. We're also online on civiccentertv.com/watch-live, or if you're on our website, go ahead and click on this Watch Live link right here if you're watching us on television, and you'll be able to watch us live in high definition each and every day. In addition, we're on great community radio stations such as 89.3 Lakes FM, 88.1 WBFH The Biff, and WAHS 89.5 Avondale Community Radio. Three great community radio stations here in the local area in Oakland County, bringing you the news each and every day. Today, we're also, as always, on Facebook via Facebook Live. Today, our Facebook partner is the West Bloomfield Township Fire Department. We thank them for joining us as we bring you some of the top stories of today on CivicCenterTV.com. Governor Gretchen Whitmer yesterday at her press conference mandated implicit bias training for all Michigan health professionals. Governor signed an executive directive requiring implicit bias training for healthcare professionals to address racial disparities. COVID-19 has disproportionately impacted the African American community, and Governor Whitmer believes that the numbers corroborating this disparity have had a lot to do with the uneven healthcare delivery. Dr. Randolph Rash from the Michigan State University College of Nursing spoke on the subject during yesterday's press briefing and said, quote, "It is especially important in how we gather a history, how we do physical exams, and how we make decisions about the data and how we use that work with patients to develop the best health care that we need," end closed quote. Governor Whitmer also threatened stricter laws if Michigan residents refuse to, quote, mask up. The governor threatened to impose mask-wearing laws due to spiking cases of COVID-19 numbers. Governor Whitmer said, "Over the past week, we have seen an uptick in COVID-19 cases, and over the holiday weekend, we saw countless Michiganders gathered in large groups to celebrate the 4th of July without a mask. Rising case numbers in southern states are also very alarming, and Governor Whitmer warned that what's happening in states like Florida could also happen here," and is very much putting herself on the forefront, making sure that she warns people in Michigan she is not afraid to move us back into Phase 3 or avoiding moving us into Phase 5 of the Michigan Safe Start Plan if these cases in COVID-19 do not discontinue to spike. Lastly, on our page on CivicCenterTV.com/coronavirus, new case numbers dropped a bit from Wednesday. On Thursday, we saw just 446 new COVID-19 cases in the state of Michigan and 9 more deaths as well. These numbers are still representing a spike in cases, and Governor Whitmer, of course, as we mentioned, is threatening more restrictions if the state can't get itself under control. According to the governor, 20% of COVID-19 cases are between people ages 25 to 34 years old. So again, still the trends for new COVID cases are in the younger population, and these cases these spikes in these new cases are influencing industries all throughout the state of Michigan, and they're really putting a toll potentially in the future on our small businesses. And to talk about that impact now, we are joined by former Lieutenant Governor and the current president of the Small Business Association of Michigan, or as many of you may know it, SBAM. Joining us now on the show is Brian Calley. Brian, thank you for being with us today.
A pleasure to be with you. Thank you for having me on the show.
So how are you? How's your team at SBAM doing?
Well, we've been working remotely since the end of March, 100% remote, so all 26 of us, and we're basically 100% on COVID-19 response and support to our members. So we've got now almost 29,000 members, and it's been quite a journey that they've been on over the course of this time, the closures and then the reopenings and all the new things that have to be done. But I must say that small businesses really have stepped up to the plate when it's come to safe practices, taking care of their employees, and doing the best that they can in such a challenging environment.
It really has been a huge challenge for these small businesses, having to pivot, having to shut down and figure out how to keep afloat, keep alive while not in operation, and then come back when the shutdowns and the restrictions were lifted and try to have a good surge to be able to have a strong summer and a strong fall and hopefully finish out the year with some semblance of recovery from what happened during the shutdowns. But now we're seeing a spike in new cases in the state of Michigan. We reached a record number of single-day cases that hadn't been reached since early March. And today it's reported that Thursday's cases were 446 new cases and 9 new deaths in the state. How great of a concern is it for the small business community that this spike may continue and could potentially lead to more shutdowns?
Well, there is certainly some concern. The governor had used some language that suggested that it was on the table moving back to phase 3, although since then I think they've kind of walked that back, which is appropriate to talk of a statewide movement back, because really there's a lot known about where the infections are coming from. And many are coming from social situations, in other words, not people going to work. But there are still some issues in congregate care facilities, or in some of the migrant population and farms where they live and work together, and there's close exposure. So the more that we know about it, hopefully the more we can target the public policy response, so that you're using a scalpel and not a sledgehammer to deal with the problem.
We're joined by Brian Calley, the president of the Small Business Association of Michigan, with us on the Oakland County Megacast. We've seen you even join the governor at our press conferences and urge the people of the state of Michigan and all of our communities to continue to take the precautions necessary so that we're able to protect our small businesses, keep them open, allow them to thrive as they have reopened, and urging them to respect those guidelines. Have the people of Michigan, do you believe, been listening to those calls that you've been heeding, or are they taking it seriously enough?
Yeah, and it's all across the board. Obviously, there's politics infused into all of this as well, which makes it much more complicated. But what we're trying to do is to really focus in and help our members and small businesses to focus in on controlling the things that they can control, and that's what happens in their facility. And so there are some that have been open the whole time because they were in that original essential services category. And there's others that closed down and reopened. And then, of course, there's still others that have never been able to reopen, like gyms and theaters and entertainment venues. So there's a wide range of experience there. But one thing that we're urging our small business owners to do is to get back in that mindset about when they first reopened. And test some of their assumptions. Are they still as vigilant as they were in the beginning? Have things been relaxed? The last thing that you want to do is to have some sort of an outbreak or disease spread tied back to your facility. And so it's not really terribly complicated, but it's extremely important to manage the risk in each facility. And we know that there are some main pillars to that. Health screening among employees is kind of that first line of defense, but then also engineering distancing into your process. So it's not something people have to remember, but it's just a natural outcome of the way that you do business. And then sanitizing and disinfecting commonly touched areas, and then personal protective equipment is kind of that last line of defense. Those are the main pillars, and it's, if there's high fidelity and attention given to those areas, we know that it does prevent disease spread. And so that's what we're hoping for today, is that we can just recommit ourselves to this to ensure that we stay safe so that we can stay open.
Former Lieutenant Governor Brian Calley and current president of the Small Business Association of Michigan with us on the Oakland County Megacast. Bridge, Michigan recently reported that there's a potential for $100 million in relief aid from the state of Michigan's allotment of federal CARES Act dollars that would be going to small businesses. How critical at this time are those funds to helping this recovery of our small business community?
Very, very critical. In fact, I was pleased that the legislature has really targeted this to the smallest of businesses. So there are, which are the ones, frankly, that are in the most distress right now. And so the way that this works is that any business with fewer than 50 employees that has been negatively impacted by COVID-19, by this pandemic, can apply starting on the 15th of this month, and you'll apply centrally through the MEDC's michiganbusiness.org website. But the decision in terms of how to allocate the money will go to local economic development organizations who have on the ground intelligence of where the biggest needs are. And $100 million, I'm from a little town called Portland in central Michigan. 100 million is a lot of money to me, but it really won't go very far when you consider how many small businesses exist in our state. So the amount that you can get is limited. The maximum is $20,000. And it's meant to help businesses restart and deal with all the challenges that they face as they're trying to rebuild their business. In fact, a lot of small businesses, they're back in startup mode now. I mean, totally had to shut down, and they're literally starting over now. So this will be an important infusion of capital.
That $20,000 maximum for individual grants to these businesses, it's no insignificant amount of money. $20,000 is a lot of money, and that could help for critical systems such as payroll and allowing these companies to pay the current talent and prevent layoffs, or maybe even bring some people on to help them with this resurgence. Just how much are small businesses right now hurting for talent or struggling to get by with a skeleton crew of staff?
Well, we have asked our members how they felt about even surviving, and about 1 in 7 were not confident that they're going to survive. Most businesses expect a significant decline in overall sales or revenue for the calendar year 2020. And so that makes it difficult. Even as you think about restarting, there's a lag between when your expenses start and when the income starts rolling in. So you got to pay your help as soon as they start. But that doesn't mean that you have any money coming in yet. And so these restart grants will go a long way for that, but they'll also help with the types of investments that businesses have to make in the change in the layout of the business. There might be barriers that have to be installed, the purchase of personal protective equipment, the kind of re-engineering the way that the workflow works. I mean, there's expenses with all of these things, maybe a new ventilation system, who knows? And so these grants were really meant to get right at those issues that are so challenging when it comes to ramping up a business. And it's really heartbreaking because so many of these businesses, they made it through their startup period. They survived. They made it to a point of maturity, and now they're right back to where they were years ago, and back in that place where it's they're essentially having to rebuild everything.
One of the things you mentioned was about testing. What are you telling the small businesses when it comes to testing? Should their employees be tested? How often are those employees being tested? And is it too much for these small businesses to take on the cost of that testing?
Well, it's not actually COVID-19 tests that I was talking about. It's daily health screening. And there are apps, including a free app that the state provides, that where an employee every day can, before they come into the office, they answer a series of health screening questions. Do I feel feverish? Have I had a cough? Have I been in contact with a person with a fever or certain symptoms in the last 24 hours or since I last came into work? So there's an application where you can screen out a lot of the risk in the first place. And it's a procedure. It's something that has to be done. The idea of health screening itself, as long as it's something that doesn't have to be done on site or doesn't have to be done outside the facility, we think is a doable task. When it comes to the actual test itself, that's done by the healthcare agencies. There's a great network out there. Insurance does cover the cost of a test, and certainly anybody having the main symptoms of COVID-19 ought to be tested. Or if you know that you have exposure to a person with COVID-19, then testing would be a good idea too. But testing itself is one thing. That's usually if you have some reason to think you might be sick. But health screening for businesses is a first line of defense. That's just employees answering questions. And then what happens is the app itself, the phone app itself, based on the way you answer the questions, will say, yeah, you should stay home today, or you can go into the office.
Brian Calley with us, the president of the Small Business Association of Michigan on the Oakland County Megacast, president of the Small Business Association. Brian Calley, previous surveys of small businesses, and you had mentioned this earlier, have been pretty murky as far as the outlook for the future, with very few expecting to survive the pandemic at all. Is that still the case right now, or is there some cause for optimism looking into the future for these small businesses?
Well, it was right around the time that we were moving into phase 4 when we last did a survey. And then as it looked like the state was heading toward phase 5, the more broad reopening that happened in northern lower Michigan and the Upper Peninsula, there was growing optimism. That's kind of anecdotal, but we hadn't surveyed since then, and now there's a lot more uncertainty that has been added in, and nothing will throw a damper on economic activity like uncertainty. So as we continue to monitor what's happening in southern and western states, and we also look at a relatively minor uptick here in Michigan certainly compared to what we see happening in places like Arizona, Florida, California, Texas, even South Carolina and Georgia. The Michigan's increase looks very mild. However, it's easier to contain when it's small than it is obviously when it's bigger. So that's I think that uncertainty that has been kind of reinserted into this process has really hurt the confidence. But we'll probably go out with another survey. We'll wait a few more weeks on that. We just like to space them out enough to where we're picking up, truly the new mood or sentiment. But I would guess that the optimism that we had gained about a month ago is probably ebbing a bit now.
Brian Calley with us, the president of the Small Business Association of Michigan. Just a couple more minutes with you before we have to let you go. Anything else that you'd like to touch on before we let you go today?
Well, the main thing that one of the main concerns that we have moving forward is as the state contemplates ways to figure out how to get better compliance with the use of face coverings and masks among the general public, we really, really would urge all policymakers not to put frontline retail staff and restaurant staff in charge of general public compliance. It's one thing to expect a business owner to make sure that their employees are complying with the rules and using PPE. But really, it's such a difficult and controversial issue on what the general public is doing, and the enforcement of that really, we just really do not feel that the business, the frontline retail staff are in a very good position or have the training to de-escalate issues or to deal with the overall compliance. So to the extent that the state wants additional compliance with the general public, it really should be the state that handles the enforcement and not put that on the backs of the small business owners and their staff.
Well, thank you very much for being with us today.
My pleasure. Great to be with you.
Brian Calley, the president of the Small Business Association of Michigan, with us on the Oakland County Megacast, and a huge concern, Ronnie, is these new spikes in COVID-19 cases in the state of Michigan for these small businesses who have worked so hard to come back from being shut down for as long as they were to be able to now be reopened and have been reopened for so long. Many of them, if they were to shut down again, are going to be in a position where they may not ever open again.
There are so many moving parts to this entire issue, and so to hear from someone that is on basically the front lines dealing with the small businesses every single day to get their perspective is always good to have that knowledge and that experience, especially when he's bringing up the issue about the mask, because you have to remember, so maybe you do put the signage up and you're encouraging people, but if I have an employee that's like a 17-year-old, do I really want that individual confronting someone that refuses to put a mask on that comes into my establishment? And, as long as your employees are doing it, can the business be cited? And we've had these situations where, there was the case in Flint where the security guard was killed over requesting someone to put a mask on. So it does get into these sticky situations. So he brings up a great point there as well. And those are the issues and that the policymakers need to understand and have that perspective as well.
Yesterday, Governor Whitmer at a press conference did press saying that the state needs more help from local law enforcement in order to enforce these COVID-19 guidelines, such as mask wearing and social distancing, especially if they're reported by these businesses. And on our website at civiccentertv.com/coronavirus, authorities are unsure who would be responsible to enforce a potential Michigan mask law. A big question after Governor Whitmer's press briefing yesterday is who would enforce this law if it were put in place in the state of Michigan. As of now, the governor's executive orders for masks have been voluntary compliance, and businesses that require it can choose to refuse you service if you're not wearing one. However, with rising COVID-19 cases, Governor Whitmer said she might impose stricter mask laws. Should local police departments have to enforce such an order if it went through? Should a state-sponsored group be called in, or should businesses enforce it all on their own? Nobody wants to be the mask police, so please just wear masks indoors, and hopefully we'll be able to up our compliance and not have these issues. But it does raise the issue if you're Governor Whitmer and if you're local law enforcement and if you're definitely local businesses, if these laws become stricter, how are you going to be able to go to each individual business, to each individual gathering place, and up to each individual person and make sure that they are following what in that case would be the letter of the law? It's a very hard task, and I don't know if it's entirely going to be something that would be possible.
You're already having issues with a lot of police departments are overtaxed as it is, dealing with other crimes. Are we going to put more pressure and more phone calls on them to report every individual that comes in not wearing a mask? However, your police department would be in a better situation to handle some of these cases, because we've seen there have been some brawls that have happened in stores across the country from people not wearing masks. So these situations can sometimes get quickly out of control where police do need to be called. But on the other side of that, you're telling, there's this big push to defund the police, which could lead to cuts. So then there's going to be less officers to actually respond to calls like this because they're going to take things in priority. And I would imagine this would not be a top priority crime for them.
And even beyond that, if you're thinking about it from a local level, enforcement's going to go from the state, and then it's going to go to the county, and then it's going to go to local departments. And there's many local and county departments across the state that already have said we're not going to enforce the governor's orders. So if another order comes down from the governor's office and becomes the letter of the law, there's a question then also of whether or not these departments are even going to cover that. And then if they aren't going to enforce those laws, and they're not being enforced by these local businesses, because to a certain extent they can't enforce it beyond asking nicely, asking people to leave, and if they don't leave, asking for help from the authorities to make the person leave, then it becomes the question of bringing in more staffing, like a special task force, which was brought up in that article, or bringing in the state police. And you go back to what you just said on overburdening too many agencies and too many people in one simple direction because people aren't following directions. So it does create the question in this case, if you're going to put stricter mask laws in place, before you can do that, you have to have a specific plan that is going to be followed by those involved in enforcing that plan to make sure that these regulations are being properly enforced.
People do not like change, and I wonder if back in the day when we were required to wear seatbelts for the first time, I remember that was a big issue where people didn't want to do that. Or even if you go into a store, there's typically a sign, or you just know, no shirt, no shoes, no service. So now no shirt, no shoes, no mask, no service. Is this partly because people think it's their right, or is this also we just don't like change and we like to fight change?
Of course, nothing is official just yet from the governor. That was just something that she brought up as a possibility for what may become law later on if we continue to see a spike and there continues to be incidents like we saw in Cass County over the 4th of July weekend, like we saw at Harper's in East Lansing a couple of weeks ago, and other various locations throughout the state of Michigan since. We're going to take a quick break, and then we'll come back and we'll talk about COVID-19 from the medical side of the coin with Dr. Jamie Taweel on the Oakland County Megacast. You're watching and listening to us on our family of TV and radio stations.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Welcome back to the Oakland County Megacast on a family of TV and radio stations all throughout the Oakland County area, on Birmingham Area Municipal Access and on Civic Center TV, on Comcast Channel 15 and AT&T Channel 99, as well as on 89.3 Lakes FM and lakesfm.com, 88.1 WBFH, The Biff, a service of the Bloomfield Hills School District, and on WAHS 89.5 Avondale Community Radio, that is service of Avondale Schools out of Auburn Hills, Michigan, under the service of station manager Marty Schaefer, engineer Keith Fraley, and student engineer Logan Pizzurro. Been with us each and every day here on the Oakland County Megacast. In addition, today we are broadcasting live via Facebook Live with the West Bloomfield Township Fire Department, and thank them for being with us today on the program. So, a rise in COVID-19 cases across the state of Michigan, concerns of a potential second wave. We're also seeing less hospitalizations and less deaths each and every day with this recent spike. To talk about what that means in the context of where we're at in the pandemic, we're joined now by Dr. Jamie Taweel. He's an internal medicine specialist at Grand River Medical Associates. Dr. Taweel, thank you for being with us again.
Thank you for having me. How you guys doing?
Doing all right. How are you, and how's your team at the practice?
You've been busy.
Yeah.
As always.
Yeah, to say the least. So we've seen a bit of a spike in COVID cases in recent weeks, and it's concerning a lot of people, with younger people being the majority of these new cases. Should the spikes still be a concern, or is this spike a result of more testing, and we maybe should feel more optimistic because of the smaller hospitalization and death toll numbers?
So it's multifactorial. There's different reasons for it. I think a little bit of opening up of Michigan, that we're starting to relax things a little bit, that caused a bit of an uptick in cases. I think the other concern is that the testing has gotten better. We're also doing a lot more antibody testing to see people that have been exposed in the past. So we might be getting some of that, those numbers that were positive previously, we're now adding that to the pile, so to speak. And things like that. But it is creeping up. It was to be expected. It's still manageable, but at the same time, we want to make sure it's not rising too aggressively. That's always going to be a big concern.
Are there concerns within the medical systems at play that they may become overburdened again if this recent spike is not thwarted soon?
Oh, absolutely. Any medical systems, the reason we're doing all of this whole flattening the curve thing, is so that we can avoid overwhelming the hospital resources. So, there's always going to be a bit of concern. I'm confident we will not get back to that point where we were completely running out of ventilators and, we were running out of personal protective equipment, things like that. I think it's starting, the lesson has been learned and people are starting to smooth out a little bit. However, that always can be a possibility. I hate to be doom and gloom all the time, but, as a medical professional, you want to make sure that we're not going to overwhelm the system. So it's a balancing act.
One of the major issues in the first wave of the COVID-19 pandemic in the early spring, when this was first getting started, was that hospitals were overburdened, as you mentioned, and they were having trouble getting PPE. We were competing between country to country. We were competing state to state in order to get hospital gowns that were fresh, masks, N95 masks, and other personal protective equipment for those on the front lines, and ventilators for hospitals on the front lines as well. In recent times, we've heard from various hospitals and in various articles that the stock of PPE is at a better place now than it was before, and that that the systems are in place that if there is a second wave, PPE stock may not be as major of a problem as it was during the first wave. With that being the case, and understanding what's going on in states like California and in Texas, definitely in Arizona and in Florida, if there were to be a similar situation arise in Michigan where we have this spike turn into a surge, can we survive a second wave? Are our hospitals going to be able to deal with that problem?
That's a tough question for me to answer, quite honestly, because I don't have the data with regards to what hospitals have on hand. I think that if we get another surge, we're going to get jammed up pretty quickly. That's just my personal opinion, is that it's going to be tough because you have to consider how often PPE gets used. You know, if a patient comes to the emergency room, PPE for the patient, PPE for the physicians, the nursing staff, and then they have to recycle it with each patient. It has to keep on going. Any surgical procedures, anything, and it has to keep on going. I don't doubt that we could very potentially run out awfully quick, because it's something that that is so necessary to prevent this surge from becoming another humongous surge. So it's, you know, the important thing is as hospitals, we got to try and conserve when things are going smooth as opposed to when things are going bananas. So when COVID, you know, initially surged, everybody was conserving PPE as best they can. And now that we're a little bit of a down, you know, it's rising back up slowly, but we're not anywhere near where we were when it first started. The good news is that this is a time to also practice some conservation as well, so that, you know, when things do get a little bit more aggressive, hopefully not, but when they do, we're better able to prepare for that.
Dr. Jamie Taweel with us. He's an internal medicine specialist at Grand River Medical Associates. So we've seen some COVID-19 antibody medications recently reach phase 3 of their testing. Can you briefly explain how directly receiving these antibodies from a medication could help either prevent COVID-19 or help people that may contract the virus deal with the virus after they are infected?
Of course, the antibody is basically a signal for the body, is the method in which the body attacks the virus. So if we were to be able to create some sort of therapy to assist the body in using those antibodies to help combat the virus, it would be more beneficial for the patient. Essentially what happens is, just like if you were to get like a vaccine, the antibodies would build up into your system, your body would be better prepared and already addressing that virus, so to speak, to prevent it from happening again. So it would be a good thing. Hopefully that will be coming down the pipe awfully soon.
Are there any dangers that are presented with these antibody medications? Any cause for concern for some people there's side effects with any kind of medicine, Dr. Taweel, but in this case, are there any major concerns that these could have adverse effects on some people?
Certainly. It can always cause some sort of an allergic reaction. That's always going to be the big concern. The other big concern is that your body might, the antibodies kind of are the attack mode for the body for your body to basically combat this. And another concern could always be that your body would, mount an attack against other things. For example, autoimmune diseases where your body starts to attack itself, things like lupus, etc. So there's always a concern that could happen. Those risks obviously are going to be low, or else the drug would not be approved for widespread use. However, those possibilities do exist, specifically in more riskier patients for things like that.
Dr. Jamie Taweel with us, internal medicine specialist at Grand River Medical Associates on the Oakland County Megacast. Dr. Taweel, it's really freaking hot outside right now. It's horrible. I mean, Ronnie and I, you can't see us on the Zoom call, but both of us are wearing black today because we're just the daredevils of local news, I guess. How can folks remain cool during this heat wave, and what are some of the danger signs that some people need to be cautious of if they become overheated?
Oh, absolutely. Of course. Obviously maintaining hydration is going to be your best bet to try and avoid getting overheated. Maintaining hydration is a big deal. Your body loses a significant amount of water as it begins to overheat. So as long as you are continuing to hydrate, you are really assisting yourself in preventing getting overheated. Don't exert yourself. Listen to your body. If you start to become short of breath, lightheaded, dizzy, things to that effect, headaches, those are signs. Get into a cooler area. Get yourself cooled down. Hydrate. So those are going to be the basic ones. But again, making sure that you're listening to your body. Try not to push. Oftentimes people get into trouble because they tend to downplay symptoms, and they go through them and they ignore them, and that can be a little aggressive, specifically in the heat. If you're working outside, if you're a runner, you are already losing a lot of water. And if you continue to do that in a heat, you're going to lose it a lot more significantly. So make sure you're hydrating, etc.
In the case that someone is feeling these adverse effects from the heat, they've been overexerting themselves outside, at what point should somebody be seeking medical help?
Whenever they're getting symptoms. So, when is it too hot? When it's too hot for you. So if you're starting to have an issue where you're not urinating as often as you typically do, or if you're, again, like I mentioned, headaches, dizziness, shortness of breath, lightheaded, any chest pressure or pain, those are signs you need to get evaluated relatively quickly. Drinking water alone at that point may not be enough. You might need to get it intravenously through the emergency room so that you can maintain hydration.
How deadly is it if people do not properly address these negative symptoms from heat and from exhaustion?
Well, it typically depends on whether or not you already have medical issues going on. So for example, if you were a cardiac patient, this could definitely strain the heart to such a degree. As you become overheated, your heart beats faster. It's like giving yourself almost a stress test. You could be putting yourself at risk for cardiac events. If you're a typical person that has no real medical history and you're starting to get overheated, you can start to cause a lot of problems with your kidneys. You can start to cause a lot of problems with the end organ damage, things to that effect. Muscle cramping and aches can cause muscle damage as well. If you're on particular medications, it can compound those things. Most importantly, just your kidneys and your hydration status, which are the big things that you want to avoid damaging first.
Dr. Jamie Taweel with us on the Oakland County Megacast. He is an internal medicine specialist at Grand River Medical Associates. Timing is everything in most cases, and definitely in emergency medical situations. If someone is feeling these symptoms, what is that critical window for them to go get treatment?
Well, that's a tough one. It's simply because sooner the better, obviously. The critical window, if you start to have symptoms as soon as possible, within the hour or two, to make sure that it doesn't continue to progress. There's going to be a tipping point where if you're having problems, then it starts to compound on itself. For an example, if you are dehydrated significantly and you're getting overheated, you're getting breakdown into your muscles, your kidneys are causing damage. The breakdown products from those muscles actually can clog the kidneys and further compound that damage. So the quicker you get that resolved, the better it's going to be. And it's not this straight linear curve. It's more logarithmic. Once you hit that tipping point, things go dramatically worse, if that makes any sense.
I know that you deal with humans, but one time I went through this with my dog, and I remember thinking to put her in an ice bath. Does that work for humans as well?
Well, yeah, it definitely can help with cooling things down. Hydration, again, I'm always going to stress hydration, but maintaining a lower temperature, absolutely. As the temperatures do increase, you're gonna get some problems that are going to happen internally. And again, muscle breakdown, organ damage, things to that effect. So if you are finding yourself overheated, you are getting symptomatic, yeah, absolutely. Getting in an ice bath will help. Getting hydrated will help. Getting to the emergency room will help.
Recognition of these symptoms is absolutely key. And so with people outside, they're exercising, they're going for runs together, they're playing sports together, they're shopping together in outside settings, whatever it may be, or they're working out in their yards. For people that are either working with other people or hanging out with other people or are just observing other people as they're passing by, what are some of those symptoms they need to be looking for heat stroke and for heat exhaustion, so that they can help other people that they're with or that they see get the help that they need?
Probably the most important thing that I would think would be the symptoms that don't go away rather immediately. You're going to get tired, you're going to get more fatigued, you're going to get a little bit dehydrated when you're outside doing those things. But typically, if you rest a couple minutes, things will get better. It's definitely a sign that you should go, seek cooler areas and things like that. And it definitely, continue hydration, continue to get cooler, and going in that direction. But if those symptoms don't go away when you're resting, then that can be something a little bit more dangerous. If you're getting lightheaded, you sit down or you lay down and it doesn't get any better, or if you sit down or lay down and then you immediately get up and it returns, those are going to be problems. So anything that doesn't resolve rather immediately, and of course, anytime you're significantly short of breath or having chest pains or having blurred vision or, lightheadedness, like you're going to pass out, and it doesn't go away rather immediately, that's a definite sign you should be contacting somebody or you should be seeking further help.
Dr. Jamie Taweel with us on the Oakland County Megacast. Before we let you go today, Dr. Taweel, anything else that you'd like to touch on or any other important information for our audience to know?
Yes, I think I want to stress again the mask wearing. The question shouldn't be whether or not you wear a mask. The question should be, why isn't everybody wearing one? It's specifically during these times. Make sure that the mask is fitting appropriately. I'm seeing a lot of people that are getting the nose out for over the mask, and I understand that they are completely uncomfortable. I understand that they can make you feel claustrophobic, and I understand that they're dramatic. Someone had once said to me, "If you don't like the mask, you're really not going to like the ventilator." And it's a little bit of an extreme argument, but at the same time, it could be a potential issue. Make sure that the mask is snug around the cheeks. It's not billowing out. Try not to use your hands to adjust the mask. Use the ear straps if possible. The other things, those masks that typically have a valve on them, those are pretty good masks to have. However, the problem with those valves are, more often than not, they protect you against air coming in, but they don't protect against air coming out. They're a one-way valve. So as you breathe out, it'll plume out your breath, and that can be an issue as well. So try to avoid those masks that have valves on them. And other than that, I think just keep on being vigilant. We will get there. It's just going to take some time, but things are hopefully in a good direction.
So I have a quick question for you, because I will say I always forget my mask. So I do the neck, or like the scarves, so I can just pull it up and pull it down, and then I have multiple colors so it can match my outfit. But I'm a chick. That's what we do. But as soon as I leave a store, I tend to take it down to walk to my car. And partly too, right now, it's so hot outside. So when you're keeping this on, you feel like you can't breathe. Is it okay to wear it in a building and then take it down if you're outside walking to your car? Or should you keep it on the entire time? And also, I see a lot of people wearing them when they're in their car by themselves. Should they be doing that?
So I feel that personally, wearing them outside is not as important as wearing them indoors when you're kind of in a closed space, breathing recycled air. There's surfaces that can have that. I think once you get outside, as long as you're not in a crowd or standing in a line or anything where you have a little bit of social distancing, I feel that it'd be okay to take the mask off. I feel that people that are in cars that are wearing the mask, it's probably more than anything if they just forgot to take it down. They're so used to it at this point, which is kind of a good thing. I don't think it's necessary. Cars do have air filters in them, and unless you're in a car with other people, I personally don't think it's necessary to wear the mask in the car.
How many people do you think are wearing contaminated masks?
Oh, geez, I don't know.
I'm probably one of them.
What do you mean when you say contaminated?
Well, because we, like you're explaining how to take it on and how to take it off, and disposable ones, and so many times you just pull it up, pull it down, pull it up, pull it down. Well, if I now touch a surface and then I pull it up again, is that kind of defeating the purpose? Should you be changing it all the time or every time you touch a surface? I do try to use hand sanitizer constantly in between, but I'm still at times touching a mask and touching a surface.
Which is why you want to do a few things. You want to make sure that you're not touching the mask with your hands, of course. Try to adjust it from the ear straps, again, over the nose, under the chin, that kind of thing. The other thing is that if it's a cloth mask, you're regularly washing it with detergent. When you're not wearing the mask, you're not just throwing it on a countertop or hanging it from your rearview mirror, but more so you're putting it in a plastic bag so that it can stay, not contaminated. Frequent mask washing or changing it out if it's a disposable is going to reduce your chances. Now, if you touch a mask with a contaminated hand, your risk does go up, but it doesn't go up as much as if you were not wearing a mask at all. So I'm going to always encourage you to wear that mask.
Dr. Taweel, thank you very much for being with us today.
Thank you so much for having me, as always.
Dr. Jamie Taweel from Grand River Medical Associates. He's an internal medicine specialist with us on the Oakland County Megacast. We're going to take a brief break, and when we come back, we'll do a little evaluation on ourselves and talk to journalism professor Garry Gilbert from Oakland University. You are watching and listening to the Oakland County Megacast on our family of TV and radio stations.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of 89.3 Lakes FM and Civic Center TV. In addition, we're on Birmingham Area Municipal Access, 88.1 WBFH The Biff, and WAHS 89.5 Avondale Community Radio. In addition, today, we are on the Facebook page of the West Bloomfield Fire Department via Facebook Live, and thank you for joining us as always on this edition of the Oakland County Megacast. And joining us now on the program, he is a journalism professor at Oakland University. Garry Gilbert joins us on the Oakland County Megacast. Professor, thank you for being with us today.
Thanks for the invitation. I appreciate it.
So how are you? How have you been during all of this?
These are extraordinary times in which we live, aren't they, Tyler?
Absolutely. Oh, yeah. Unprecedented times, to say the very least. So Oakland had still held classes during most of the pandemic as it moved forward. How did your teachings and the teachings of the journalism department maybe be modified or be varied in some ways to incorporate the times that we're in teaching these up-and-coming reporters to be quality journalists?
That's a great question. We're working with our young people, our students, to do exactly what professional journalists are doing today, which is learning to do their stories remotely, perhaps without a safety net, learning how to conduct interviews and write profiles and to do their research and to do their observation from home rather than from a brick and mortar office somewhere. So these are extraordinary times, as I mentioned. But I think our students are up to the challenge, and they are eagerly embracing the new technology that allows them to work to do their classroom work from home, and to do, for instance, I'm the advisor for the campus newspaper, the Oakland Post, and our students there are learning how to put out a digital newspaper while working from their bedroom.
Very, very interesting. Garry Gilbert, journalism professor at Oakland University, with us on the Oakland County Megacast. It's crazy to think that in a general election year, something else could become the story of the year. And, of course, COVID-19 is the story of the year. Coverage has been highly politicized on many outlets based on what the news folks are looking at. What are your thoughts on how the media has covered the pandemic? Has it been effective? Has it been too polarized?
Great question. Let's try it from this angle. Right now, the media are being challenged to cover two extraordinary stories. The COVID-19 pandemic has been persistent. Usually these types of stories, we have a beginning, we have a crisis, and then we have a quick resolution. That has not been the case with the pandemic, with the COVID-19 pandemic. At the same time, the news media are being challenged to cover another unusual story, and that is the protests that have started around the nation and are continuing in the wake of the death of George Floyd at the knee of a Minneapolis police officer. Covering two extraordinary stories like this at the same time, that doesn't happen very often in the news cycle, in my experience, unless we're talking about a world war and a Great Depression being at the same time. This is at the same time that the news organizations are being challenged to cover these two major stories, they are also facing financial pressure as a result of advertisers with the pandemic in the news constantly are putting their hands on their wallets and holding back on their advertising spending. As you know, for more than 150 years in this country, journalism was subsidized by advertising. That system doesn't work the way it did anymore. So we really have three unusual things occurring here. Two major stories that are demanding attention, financial pressure on the news media that are trying to cover these stories, and then three, we have President Trump and other conservative leaders around the world who are demeaning the news industry, telling the audience telling their supporters and their loyalists that journalists can't be trusted, that any stories that are critical of the White House or the administration must therefore be fake news. So this is really an unusual time, a challenging time to be talking about journalism and its role in our political culture.
Garry Gilbert with us. He is a journalism professor at Oakland University, discussing the state of our news and our news reporting. Our newspapers, Garry, and our local television, our community television outlets really at this point are critical to stories getting the information out, getting a full scope of that information to the public. But then you go to the national level, and you want to learn the story, but they want to teach you the story and they want you to learn, but they also are trying to put people in the seats, as you've mentioned, with advertising dollars. And so they tend to lean one way or lean the other way and convince the viewership on their outlet that this is the angle of the story that's correct, the other one is wrong, and there is no in between. Are we going in a dangerous direction on the national news level with having such polarization on these major networks?
That's an interesting observation, Tyler. Now, I would say that there's Pew Research that just came out yesterday, and if you're familiar with the Pew Research organization, it is a nonpartisan, nonprofit fact tank that did some surveying during the course of the summer and published the results yesterday. And those results show that 71% of Americans who responded to the poll said that news organizations are doing an excellent or a very good job of covering the pandemic. Though those numbers are rewarding. Journalists should feel pretty good about numbers that say that 71% of the public thinks that we're doing a good or a very good job at covering the pandemic. You asked the question, though, about the polarization that we see as a result. Now, it's interesting that the numbers for the evening news programs, NBC, CBS, ABC, those numbers are higher than they have been in years. In fact, for a brief period of time this summer, ABC News, World News Tonight, became the #1 rated program on television. That's really good to see. People are paying attention. Ratings are up for cable news. Ratings are up for local news. And you mentioned, Tyler, the role of the local news organizations in covering this story. And in fact, the Pew Research shows that local news organizations, meaning local television, local radio, local news websites, actually get higher ratings for their believability, for their credibility then do the national news programs. And of course, Fox News has its loyal viewers, CNN, MSNBC have their loyal viewers, but they get slightly lower ratings for their credibility and their believability.
Garry Gilbert with us, the journalism professor at Oakland University, talking to us about the state of our news in the United States. And this all didn't just suddenly happen, Garry, that the polarization, particularly in cable news is what I'm speaking of, the national news on more local and syndicated stations tends to be a little bit more centric. But the polarization generally in the United States and definitely in our cable news, it didn't all of a sudden happen. What are some of the causes in your beliefs and from what your knowledge of the journalism industry is? What is some of the justifications or reasons for how this all developed to where we're at right now?
Well, you know, Tyler, people tend to view the news media outlets that support their worldview. That means if you're a conservative politically, if you're a supporter of President Trump, you are more likely to tune in to Fox News because their reporting, and particularly the opinion shows, tend to support the view that you already hold. We like to have that sense of affirmation. Okay, these reporters, these journalists see the world in the same way that I do. If you're a liberal or you consider yourself to be a Democrat, you are more likely to watch a program like MSNBC or Rachel Maddow, because the stories that they're going to report feed you, shape you, reflect, mirror how you already feel about the world. Now, editors at the New York Times, editors at the Washington Post certainly understand that their audience skews in a liberal direction. So they're going to try to give you all the news that they think that you need, but they're going to shape that news to keep their audience. That means that this partisan, that we're sort of in these, you've heard this expression that we're in our silos, that we're in our information bubbles. In my classes, and also some speaking events that I do, I try to encourage people to move outside, to get outside of their information bubble, to challenge themselves, to read widely. The Rabbi Sherwin Wine, was a controversial, charismatic figure in this market for a long time, used to say, "Why would I spend my time reading the views of somebody with whom I already agree?" And what he meant was that we should challenge ourselves. We should, if you consider yourself to be a liberal or a Democrat, you need to watch Fox News once in a while to see how people on the right are presenting their argument. If you're a conservative, if you consider yourself a Republican, you should be occasionally watching CNN, MSNBC, reading the New York Times in order to see how the left is thinking. It doesn't help at all if you insulate yourself and hang out only with reporters and journalists and with members of the audience who see the world the same way that you do.
With the decline of newspapers and investigative journalism, what do you see the future of journalism being, and what advice are you giving to students that want to go into this industry?
Great question. 20 years ago, I used to be able to tell my students, if you do well in my classes, I will be able to find you a job, and it will pay you well enough that you can live a comfortable lifestyle. I can get you a job at a newspaper in Detroit or in Chicago or in New York. I can't promise that anymore, of course. So our students are learning to be creative and enterprising and entrepreneurial. I am a product of the newspaper industry. I spent more than 30 years working in that industry. I could see the handwriting on the wall in around 2006, 2007. That's when I decided to go into teaching full time. My timing was pretty good. I still have a lot of friends who work in the newspaper industry. Now, that said, I am not nostalgic about the decline of print newspapers. We have today the best system for the collection and delivery of information that's been invented so far. The digital news environment is the best system developed so far. I'm excited to see where it's going. The problem, of course, is how do we pay journalists? How do we make journalism a worthwhile living? How do we, the students that I have who want careers in journalism, how are they going to get paid? That's the major question. Where we have this experiment that's going on in this country right now where information is expected to be free, that I should be able to log into a website and get all of the news that I need, and I shouldn't have to pay for it. That experiment's been going on for 20 years, and that it needs to change. If news organizations have quality, proprietary content that they can deliver to the audience, they should be able to charge for it, and the audience should be willing to pay for it.
Garry Gilbert with us. He's a journalism professor at Oakland University. Social media professor is also critical in today's age to news delivery, and for better and for worse. It's news reporters and news organizations that are delivering news as it happens, as it breaks, as it develops through social media immediately to the consumer before sometimes it even gets to television or to radio or to other outlets. But you also, on the other side, have the general public that are being, in some way, for lack of better terms, vigilante reporters that are going out and reporting information that may not entirely be true. Do we have a dangerous precedent in the current social media landscape in terms of reporting news, or is this going to be something that in the future is going to help coverage of the news be more accurate and be more expedient and expose more of these truths that are hidden to the public that the people need to know?
Boy, an argument can be made that we're going through the first true social media infodemic, if you will. The way information spreads today through social media without being verified, without being fact-checked, is truly concerning. Back in the 1950s, Ed Murrow, the father of broadcast journalism, said he was worried about the fact that a falsehood could go around the world at such speed while the truth was still trying to get its pants on. And he was talking about television in the 50s. Today, as you know, in a viral moment, news can reach billions of people without any filter on whether it's accurate, whether it's true. And in fact, we know that there are people using social media to deliberately distort information. Misinformation is one thing. Disinformation is truly even more dangerous. Facebook, Twitter, YouTube, the administrations of those platforms have attempted this summer to try to put some restrictions on the amount of false information that is circulating on their platforms, but so far it doesn't appear to have been very effective. By the way, there is research that shows that Americans who get their news primarily through social media tend to be less well informed than those who use local television news, local news websites, or the national news organizations.
Professor Garry Gilbert from the journalism department at Oakland University with us on the Oakland County Megacast. Looking into the future, Garry, is there other signs of hope for journalism as an art, as a science, as a craft, as an important industry in every society on planet Earth, that we're going to have more of that sense of the glory days, so to speak, where you saw your journalist on TV, where you heard the journalist on the radio, where you read them in the paper, and you could trust that the information you're getting is solid? And that also incorporates those that are on social media reporting news as well. Do we have signs of hope for the future that this polarization and this misinformation is not going to be this major problem for long, and eventually we are going to get through this infodemic, as you said?
Mm-hmm. Yes, I am encouraged, and certainly, I have 100 students at Oakland University who are majoring in journalism. I want them to be able to graduate and find good jobs. I'm encouraged by what I'm seeing this summer as people, as we are grappling with these two major stories, the pandemic and the mass protest across the country in support of Black Lives Matter. I'm encouraged by the fact that ratings are up for television news, that ratings are up for local news programs, that radio news is getting more listeners, that digital news platforms are getting more subscribers. This is certainly the fact that there are important stories and that the audience is turning to news organizations for information about those stories has to be encouraging. What I worry about, as I just tried to explain, is how will media charge for access to their content so that they can pay their journalists a living wage so that we'll be able to continue to attract people into this field. I find myself at a lot of high school recruiting events and events where I'm talking to would-be college students, and they say, I'm interested in a career in journalism. What can you tell me about the career prospects? And in the background, their parents are saying, wait, I thought journalism was dying. Journalism's dying, right? How is my son or my daughter going to pay back their tuition, pay back their loans? I say, journalism's not dying. There will always be a need for information that's been researched, that's been collected through interviews, that's been collected through observation. That research, that information has been verified and then clarified. There will always be a demand for that kind of content. The question is the audience willing to pay the cup of you know what the price of a cup of Starbucks coffee is? $3.50. Is the audience willing to pay $3.50 a week for access to quality proprietary information?
Garry, Gilbert, anything else before we let you go today?
Well, thanks for the invitation to talk about this. I do think that we're facing a real challenge, particularly on social media, in the way that the information is gathered and distributed. Again, I would encourage people to read widely, to view their news sources, to get outside their comfort zone, to occasionally listen. I think, Tyler, that we have a problem in this country, particularly on social media. We talk at each other. We don't listen to each other. And if we spent a little bit more time listening, maybe social media wouldn't be quite so toxic the way it is today.
Well, thank you very much for being with us today, Professor.
I really appreciate the invitation. I'd be happy to appear anytime.
Wonderful. We will definitely get in contact with you again very soon. Garry Gilbert, journalism professor at Oakland University, with us on a family of TV and radio stations, including 89.3 WBLD, Orchard Lake, West Bloomfield, Keagle Harbor, Sylvan Lake, 88.1 WBFH, Bloomfield Hills, and 89.5 WAHS, Auburn Hills. We will take a quick break and we'll return with more. You are watching and listening to the Oakland County Megacast on a family of TV and radio stations.
Hi. My name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in our studios at Civic Center TV and 89.3 Lakes FM. You can watch the Megacast each and every day on Civic Center TV and Birmingham Area Municipal Access on Comcast Channel 15 and AT&T Channel 99. You can also watch us online on civiccentertv.com. Go to our homepage and click on the link for Watch Live. You can watch us on your TV, on your tablet, on your web browser, and on your phone. You can also listen to us 88.1 WBFH, The Biff, out of Bloomfield Hills, under the leadership of station manager Ron Whittables, and WAHS 89.5 Avondale Community Radio out of Avondale High School. In addition, we are always on 89.3 Lakes FM and live streaming online on lakesfm.com. Today, we're on the Facebook page of the West Bloomfield Township Fire Department. They are our Facebook partner for today's edition of the Oakland County Megacast, and making headlines today on civiccentertv.com/coronavirus. Governor Whitmer mandates implicit bias training for all Michigan health professionals. Yesterday at a press conference, the governor announced she had signed an executive directive requiring implicit bias training for healthcare professionals to address racial disparities in healthcare. COVID-19 has disproportionately impacted the African American community, and Governor Whitmer believes that numbers corroborating this disparity have a lot to do with uneven healthcare delivery. Dr. Randolph Rash from Michigan State University's College of Nursing spoke on the issue during the press briefing, saying, quote, "It is especially important in how we gather a history, how we do physical exams, how we make decisions about the data, and how we use that data to work with patients to develop the best healthcare that we need." So implicit bias training will be required in medical fields for all professionals. Governor Whitmer also has signed this is just in now, reported from Fox 2 Detroit. Governor Gretchen Whitmer has signed a new mask order requiring businesses enforcement and crowded outdoor spaces are now included in that order. Governor Whitmer signed the executive order addressing mask issues during the COVID-19 pandemic. That is Executive Order 2020-147, reiterating that Michiganders are required to wear a facial covering whenever they are in a public indoor space. So that speculation of whether or not that would become law, it is now law. That is news just into us here at the Oakland County Megacast. So on that note, Ronnie, the requirements now in place, it goes back to what we discussed earlier on in terms of enforcement. That's also going to be something that is going to have to be further required on the local level, but compliance is still going to be an issue in that case.
This says that businesses open to the public are now required to refuse entry or service to people who refuse to wear a face covering, with limited exceptions. I wonder if they're going to come up with some type of maybe identification, maybe a wristband or something that your doctor issues to you if you have a health reason for not wearing a mask. Something that would be able to easily identify you so that maybe you don't come into these situations, so that, the average worker at the grocery store or the, department store understands quickly that you have a medical reason for not wearing a mask.
Yeah, there are various reasons why someone may not be able to wear a mask, and there has to be some effective way to identify that. Governor Whitmer's executive order issues that require any business that is open to the public to, as Ronnie said, refuse entry or service to people that aren't wearing masks. It requires the use of facial coverings in crowded outdoor spaces as well, so we won't have a situation like we saw in Cass County over the 4th of July weekend, and reiterates that individuals are required to wear a face covering whenever they are in an indoor public space, regardless of the population. So that now is a developing story that came from yesterday's press conference and recent outbreaks of COVID-19, and now the people of the state of Michigan are legally required to be wearing those masks in crowded outdoor settings, and businesses are required to refuse entry and service to those that do not wear a mask when they go into indoor facilities. So that breaking news into our station just now. Michigan also reported yesterday 446 new COVID-19 cases, 9 additional deaths as well on Thursday. These numbers still represent a spike in cases, and Governor Gretchen Whitmer is threatening more restrictions if the state cannot get itself under control. Of course, those those threats became promises today as the stricter mask laws are now in place. According to the governor, 20% of COVID-19 cases are between people in the age group of 25 to 34 years old. That and more making news on our website on civiccentertv.com/coronavirus. And to talk about how this recent spike is affecting preparation and maybe even becoming a cause for concern in local hospitals, we are joined by the president of Henry Ford West Bloomfield Hospital, Eric Wallis, with us now on the Oakland County Megacast. President Wallis, thank you for being with us today.
Hey, thanks for having me on again today, guys.
How are you? How's your team doing at the hospital?
We're doing well. I think, we've been very fortunate, and I would say I would want to thank the citizens of, West Bloomfield and the surrounding communities. We've, been very fortunate that for the most part, we haven't seen a huge uptick of COVID positive cases coming into the hospital. We've seen a few more folks coming through the emergency department that are testing positive, but it's a pretty small number at this point. So, so far so good, but I think that the steps that you just talked about from the governor, I think are absolutely the right thing to do to make sure that folks are wearing a mask and taking care of one another.
Even though COVID cases are on the rise, as you had mentioned, in your case, the hospitalizations for COVID-19 haven't been as high. Hospitalization rates in this recent spike have been relatively low. Same with the death toll. Why does it believe that this is happening? Is it because of the younger population that's generally falling victim to these new cases, or are other factors at play as well?
No, I think you're absolutely right. I think that, generally, while younger folks are being affected more in this particular wave, they do tend to not have as severe symptoms, although I would really caution folks in those age groups to assume that because a lot of folks they won't. We've, throughout this event, had a number of what I would consider very young folks in their 20s and 30s be sick enough to be admitted to the hospital. I think the challenge is that we know still so relatively little about this virus and how it's going to affect folks. And some people are going to have really severe cases of it, and others are going to be okay. And frankly, that's just not a game that you want to play and take your chances with. So, because the consequences are pretty high.
Is Henry Ford Health System worried about another potential widespread outbreak of this? If this does surge, is that a cause for concern for Henry Ford West Bloomfield as well? And are any steps being taken to prepare for the possibility that this spike becomes a surge and the hospitals begin to have begin once again to have an influx of COVID-19 cases come in?
Yeah, I think since the beginning of the time when we started to see our cases decline in the community, we've been preparing for wave number 2. Unfortunately, what we're seeing is we're still in wave number 1. So we've done a number of things to keep ourselves prepared and be ready. And I think, things like our health system now has at least a 100-day supply of every kind of PPE that we would need based on our highest consumption rates. So we've kind of stockpiled things. We've learned a lot about this virus as we've gone along and how to keep people safe. Just was looking at some data today. I'm excited to say next week, I think we're going to hit 2 months since we've had one of our team members test positive because we've just kind of learned how to keep people safe while they're here in the building and how to treat our patients. So there's a lot of work going on behind the scenes. We fully expect to have, bumps along the road as we go through the fall. And really, until we get to a point where we have an effective vaccine, this isn't going away. I think that, some folks thought that the warm weather would make it go away. Like we see sometimes with other viruses, that's not held to be true. We don't know yet whether or not, because there's just not enough scientific evidence that, folks who have had the virus, can they be reinfected or not? We're still kind of a little bit in the learning phase on some of these things. But we've learned a lot over the past 3 or 4 months so that we can deal with this if it comes again.
Eric Wallis with us. He is the president of Henry Ford West Bloomfield Hospital, on with us on the Oakland County Megacast. Now, at this current time, we're seeing a spike. It's a cause for concern. It's certainly not a cause for panic right now. But if we do end up in a situation where Michigan's spike mirrors that of Texas, of Florida, of Arizona, of other states in the union that are seeing these major spikes right now, can our hospital systems in the state of Michigan survive a major surge like that once again, or are we going to see similar issues to what we saw during the major portions of the first wave that we're still, as you said, working through?
You know, a lot of it depends on how and where that spike comes. You know, one of the challenges that we saw with the first kind of onset here was that it was primarily concentrated here in Southeast Michigan. And so, you know, we got to a place very quickly where all of our, resources in the region were being utilized. And we were trying to look for help from outside the region really to spread out and take care of those patients. If we get to a place where we have a specific region that spikes like that again, we very well could be back in a place like you're seeing in Florida or Texas or some of these other places where resources get really scarce and the ability to have ICU beds and vents and those kind of things become more of a challenge. If the spike becomes more of a statewide surge, which I think is a little bit more of what we're seeing right now, then the resources and the need for resources are a little more spread out, and it's a little easier to manage through that. So we're kind of preparing for both scenarios. And, I think if other parts of the state get to a place where they need some help, we're prepared to try to help them out too, because we had some great folks that helped us out when we were in kind of dire straits.
For those of us that don't have experience in the healthcare industry, can you explain a little bit why we were seeing employees be laid off from hospitals and a little bit about how the financing works and trying to reopen the hospitals back open or reopen hospitals to elective surgeries or other health issues and how that helps your bottom line?
Yeah, no, that's a great question. And it's probably about a 2-hour finance class. But in short, it really, the finances of healthcare right now, healthcare systems, hospitals, really make their profit, make their resources on elective cases. Our commercially insured patients who come in and do, want knee replacements and, hip replacements and some of the more elective cases. That helps us to supplement. It's a little bit of cost shifting to supplement some of the things that don't pay us as well, like, medical cases, ICU cases, et cetera. And so what happened during the first surge of COVID was we had so many patients that were taking up resources. Every single bed was filled with a medical COVID patient. The ICUs were full, that we really had to shut down doing all of those elective procedures and surgeries. And so what really happened, and I'll speak really for the Henry Ford healthcare system, is over the course of this year, about $700 million worth of revenue just disappeared. And so it's certainly you can imagine your own checkbook. If all of a sudden you're bringing in $700 million less dollars than you planned for, that has some significant financial ramifications. We've been very thankful, very blessed that the federal government has stepped in with the CARES Act. They've provided to our health system currently about $400 million of relief. At the best right now, at best case scenario, that will help us to maybe break even. And even if we break even, that's still going to be, something on the order of $700 or $800 million of less revenue than we were planning on. So it really is significantly concerning to us. Not having that revenue takes away our ability to provide services in the future, takes away our ability to buy new equipment, takes away the ability to, give raises. And so part of our recovery plan, unfortunately, was that when our volumes were down and when we had areas that were being underutilized, for instance, our surgical teams, if they're not doing cases, their skill set's pretty specialized. You can't just pick a nurse up who's worked in the OR and say, hey, go work in this ICU. And so we made the very difficult decision to furlough some of those folks who were in places where the work was low. We did a lot of, having folks shift and work in places where we had need. But unfortunately, we did have some folks that we just didn't have the place to move them to. So it led us to try to furlough some of those folks. At the end of the day, all of our executives across the system also took, significant pay cuts this year. And what I'm really proud about the Henry Ford system is We didn't take those pay cuts or the money from those pay cuts from our executives and put them back in the coffers of the organization. We turned around and put that into a fund to help all those folks that were laid off or underemployed, so that we could help them stay financially afloat.
Eric Wallis with us on the Oakland County Megacast. He's the president of Henry Ford West Bloomfield Hospital. So in the early months of the pandemic, PPE stocks were really sparse for hospitals, definitely in southeastern Michigan, definitely in the state of Michigan, but really all throughout the union entirely. How is the hospital's PPE stock doing now? Are there plans for increasing that stock of PPE as you prepare for the potential of a second wave? And if there is a second wave, do you have enough to combat that like you may not have had at times during the first wave?
Yeah, no, we're really in a pretty good place right now. We've been very fortunate. We've got a great partnership with Ford and other folks in the community. Ford has loaned us a warehouse in Dearborn that, like I said, right now we've got a 100-day supply of pretty much everything that we would need from a PPE standpoint. I think you've also probably seen in the news where Henry Ford is one of the several health systems that have come together to actually buy some ownership or create some manufacturing here in the community to make our own PPE, so that we're not still back in a place where we're dependent on PPE that's coming from outside the country to come here to Michigan. We had a real challenge, and just as we were trying to buy PPE during the height of this, so was everyone else in the country, and so we were all competing against ourselves. We were competing against the states. We were competing against the federal government. And it just really was a bad situation. So we were very fortunate to be part of a strong healthcare system that did a great job of looking for sources all over the world. And we were flying things in from the Middle East. We were flying things in from China as we could, looking for new suppliers, working with local manufacturers to make PPE. So it's been a lot of really hard work. But like I said, I think right now I feel very confident that if another wave comes, we've got what we need to be safe and keep our patients safe and keep our team safe.
We've touched on the need for Henry Ford Health System, and including Henry Ford West Bloomfield Hospital, to have to furlough some of their workers from certain units that maybe weren't going to be utilized or were very specialized during the height of the pandemic. Are some of those workers now coming back? Are they still on furlough? Is there a chance that we'll see some of those workers come off of unemployment and back into the hospital soon as elective procedures become more common?
Yeah, no, absolutely. And actually, I saw a report this week that over 80% of the people that we furloughed are now back to work. We've tried really hard to get folks back as quickly as we can, as we hopefully can, as the work comes back. We've been very fortunate. We spent a lot of time having almost one-on-one conversations with patients who delayed what was elective care or non-time sensitive care, and so a lot of those cases have come back now. I really am grateful for the faith and trust that the community has put in this hospital to know that we can keep them safe. We can provide the care that they need, and they don't have to worry about, are they going to come into a hospital and get COVID? So as those numbers continue to grow, we've are probably just a little bit ahead of what we planned for when it comes to a return to business, which is a great thing because we're seeing patients who needed care that are getting it again. And so as that continues to grow, we're going to keep bringing those folks back as quickly as we possibly can.
Eric Wallis, president of Henry Ford West Bloomfield Hospital. Before we let you go today, anything else you'd like to touch on?
Yeah, I think, there's been a lot of discussion, I think, about the governor's mandate of implicit bias or unconscious bias training for healthcare workers. And I just would say, from the Henry Ford healthcare system, that's something that we've done for our folks for a number of years. And so it's not a new requirement. It's something that has been part of the core foundation of who we are as a healthcare system, to try and make sure that we care for all of our neighbors equally, that we make sure that we're providing the very best care we can to all communities. And so welcome that decision. I think it was a great one. And I think it's going to benefit kind of everybody as we see that roll out across the state.
How does Henry Ford West Bloomfield Hospital and really Henry Ford Health System on a broader level employ those implicit bias training? What does that look like? What kind of training procedures are your staff undergoing? Who among your staff has to undergo that? And how effective are those training processes?
Yeah, so for us, it's everybody. It's not just our licensed folks. It's everybody who works in the organization that gets trained. It's a variety of things. It's inpatient, in-person classes. It's online trainings. We look at a lot of the national data. We pride ourselves in the diversity of our workforce. I think, recently, I think several years in a row now, we've been ranked in the top 2 or 3 in the country for diversity amongst our workforce and our commitment to diversity. And so it's something that's, like I said, it's just kind of the core of who we are. We serve a lot of very diverse communities, even here in West Bloomfield. We got a lot of different ethnicities and folks that we take care of. And so our goal is to make sure that we provide the highest quality care to everyone that enters our building.
President Eric Wallis from Henry Ford West Bloomfield Hospital, thank you for being with us today.
Absolutely. Thanks, guys.
We appreciate it. Eric Wallis from Henry Ford West Bloomfield Hospital with us on the Oakland County Megacast. We're going to take a quick break, and we'll return with more for Ronnie Dahl. I'm Tyler Keefe. We'll be back after this quick break. You are listening and watching to the Oakland County Megacast.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, we're on Birmingham Area Municipal Access, 88.1 WBFH, The Biff, and WAHS 89.5 Avondale Community Radio, bringing you the news on COVID-19 and other major stories all throughout the Oakland County area Monday through Friday from 10 a.m. to 12 noon with replays every afternoon and all throughout the weekend as well. We're pleased to be joined now by the Deputy Fire Marshal for West Bloomfield Township Fire Department, who are also our Facebook partners today. We're joined now by Deputy Fire Marshal Dave DeBoer from the West Bloomfield Fire Department. Deputy Fire Marshal, thank you for being with us today.
Thanks for having me.
So this is supposed to be the last day of a week of consecutive days in our area above 90 degrees. How has the fire department been holding up and helping residents during this time? Have we seen more incidents pop up with the heat?
Thankfully, we haven't had a whole lot of incidents as far as 911 calls go. Our crews change the way they do things based on heat like this, and we want to make sure we keep our crews hydrated and keep fluids running through them, and maybe pull back on some of the outdoor stuff that we would normally be doing at this time to make sure we keep them hydrated. Because if they get a fire, once they put all that gear on and start to sweat, they're going to dehydrate very, very quickly. So it does change how we do things. It changes our uniform a little bit to keep the guys cool, but we're doing everything we can to stay cool.
As the weather does get hotter, what should homeowners in West Bloomfield and in surrounding areas be cautious of at their homes to avoid having fires in the summer due to the heat and the sun?
Fires is the one thing we don't think about much in Michigan, because typically the humidity is really high in Michigan, and we have that moisture that keeps kind of some of those fires away. Where out west, you see a lot more fires because of the dry, hot conditions that we're seeing here. When we get into a long stretch like this, that dry weather starts to build up or dehydrate things, if you will, to a point where they become more flammable. So we've got to be cognizant of that. We've had a handful of fires over the weekend, mostly related to fireworks and improper disposal of fireworks. that probably wouldn't have happened if we were in normal weather conditions for Michigan. The humidity would have been high enough to help prevent that. But with these dry, hot, I know it's humid out there today, but this whole week's been pretty dry. So that raises that risk for us.
Dave DeBoer with us. He's the Deputy Fire Marshal for the West Bloomfield Township Fire Department. There's been a lot of reports recently, Deputy Fire Marshal, of establishments, pool parties, lake parties, and just regular gatherings with young adults blatantly ignoring social distancing measures or not wearing their face masks. We've had a spike in cases recently in the state of Michigan and in southeastern Michigan. What are your thoughts on the overcrowding issues? Are you seeing a lot of that in West Bloomfield? Is there cause for concern in your fire department and other fire departments about this going forward?
There is cause for concern, and we realize that younger people may not be affected the same way our seniors were affected. West Bloomfield was one of the most impacted communities in Southeast Michigan. We had significant numbers of patients. And we still see 1 or 2 patients a day right now. It is still in our community. I think some people think it has gone away. We need to make it very clear it has not gone away. It has not left West Bloomfield. We still have patients throughout the community. So the risk is still there. It is highly contagious. And yes, as a young person, it might not take you down. But if you're carrying it, not knowing it, or out and about without a mask on, you could be spreading it to that neighbor or friend or family member that is susceptible to it and has other health risks that makes it a life-threatening issue for them. So when it comes to the masks, it's become pretty political in the last few weeks, and it really shouldn't be a political thing. This disease doesn't care what your politics are. Putting a mask on isn't a political thing. Putting a mask on is being respectful of your neighbor, which is something that we should all do here in West Bloomfield.
Dave DeBoer is joining us right now on the Oakland County Megacast. He is the Deputy Fire Marshal for the West Bloomfield Fire Department, who today is our Facebook partner on the Oakland County Megacast. There's new restrictions in place now from Governor Whitmer, Dave DeBoer, requiring people to wear masks whenever they are in an indoor facility, and also requiring businesses to refuse service to or entry to anybody that isn't wearing a mask. In addition, there's also regulations for people to wear masks in outdoor spaces that are crowded in West Bloomfield and in surrounding areas. Do you believe that there's going to be a continued issue with people complying to these orders, as we've seen in some capacity so far?
I think we will see it in small pockets. We still see it out in the community as we're out and about, where we see some people that should have masks on. It seems to be decreasing, though, which I think is a good thing. We're seeing more and more compliance with the masks. People are getting the message and starting to understand that, the minor inconvenience of a mask could get us all back to work, could get us back to normal sooner. And that should be all of our goals. We want to see our community thriving the way it was just a few months ago. We want to get back there as soon as we can. I think the governor feels the same way, that a little bit of sacrifice now is going to cut back on sacrifices later. So hopefully we get compliance from everybody. We can stop the spread of this disease and move on and get back to what normal was.
Dave, anything else you'd like to touch on today, or anything else that's important for our audience to know at this time?
A couple of things that are important for us is during this high heat and high humidity, stay very hydrated. Make sure you're drinking. If you're feeling thirsty, you're already behind the 8 ball on the thirst or the dehydration issue. So make sure you're staying hydrated. Stay away from the alcohol. We want water and sports drinks and things of that nature to keep us hydrated. And one other thing to touch on is under the state law, fireworks are done for the season right now. We're past the holiday, so there is no more fireworks allowed in the neighborhoods or in the community. So you shouldn't be hearing that stuff in the community at this point. Hopefully that's all died down, and we've had our celebration and enjoyed that, and time to move on to the next thing.
Well, Dave, thanks very much for being with us today.
Thank you. Thanks for the opportunity.
Dave DeBoer, Deputy Fire Marshal with the West Bloomfield Township Fire Department, with us on the Oakland County Megacast. And another thing that's been touched on with him on the heat wave front is just like Dr. Taweel talked about earlier on, is the importance of staying hydrated and staying cool. It's still wildly hot outside. And the 90-degree days look like they're going to be behind us now after today, but at least for a while. But it's still going to be very hot going forward in the state of Michigan.
I don't know if you've ever gone through like heat exhaustion, but it comes on so quickly. I remember one time I was walking into a store and I just fell out. And I had been on the lake all day and didn't hydrate enough, and it was just quick. And then you get a headache, and it's like a clammy feeling. So it really is important to remember to be drinking a lot of water while you're outside. Even, people are doing their yard work because more and more people are still home from work, so they're outside. If you're going to do that stuff, make sure you do it early in the morning or late in the evening. And remember as well, it's not just you, it's your pets as well. Yeah, there's a lot to be cognizant of when you're outside in the heat and in the humidity in the summer, especially midday when it's at its peak. You want to be outside. If you're going to exercise early in the morning or late in the afternoon or in the evening when it's cooler is definitely a better suggestion, a better time to be out. And then on top of that, as Dr. Taweel said, as Deputy Fire Marshal DeBoer said, keeping hydrated is so critical, and monitoring your symptoms as well, because like Ronnie had mentioned, and even to an extent like was mentioned earlier on by Dr. Taweel, heat exhaustion, heat stroke, those effects come on quickly and in many cases can be extremely dangerous or even deadly. We're going to take a quick break. When we return, we'll talk high school football and high school sports in the fall. Will sports be played? Will they be limited? That and more we'll talk with Ron Bellamy from West Bloomfield High School. He's their head football coach. Coming up next on the Oakland County Megacast.
Hi, I'm Dr. Jonae Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of 89.3 Lakes FM and Civic Center TV, which make up two of our many community TV and radio outlets all throughout the local area, including 88.1 WBFH, The Biff, WAHS 89.5 Avondale Community Radio, and Birmingham area municipal access in places such as Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin. We were recently joined by Dave DeBoer from West Bloomfield Township's Fire Department, and we thank them for being our Facebook partner on today's edition of the Oakland County Megacast. So high school sports are a huge part of the high school experience for students, as well as the community experience, especially in the fall in the state of Michigan. Joining us now on the program is Coach Ron Bellamy, the head football coach at West Bloomfield High School, to talk about those changes coming up in the fall. Coach Bellamy, thank you for being with us today.
Yeah, thanks for having me.
How are you? How's your team doing, Coach?
We're doing well. We started workouts June 22nd. They're going well. As you know, we have a pretty large football program. So, we've been able to, we're fortunate enough to have 3 separate workouts just so that our kids aren't, we're not bringing 140, 150 kids in at one time. So, we're fortunate for that, and we're going to continue to try to, do things the right way.
As you're preparing for the season and you're having these kids separated in different groups to maintain physical distancing and other safety measures, does it make it difficult in that case to prepare schematically and from a general game planning standpoint in your first string, your second string, your third string, and other sets you have coming in between? Does it make that preparation tougher as you're approaching the season beginning in the next couple of months?
Yeah, the toughest part is going to be the camaraderie. What we're trying to accomplish is we keep our guys within a position. So quarterbacks, running backs, receivers, O-line, etc. They're all in their own group with their position coach. And the reason behind that is if one kid or one group was to get sick, you kind of know where the virus is at. You can kind of track where it's at. So we've taken that approach. Like I said, Tyler, we're not really concerned about the X's and O's part of football. Everyone's in the same playing field. We're just trying to make sure our kids have some sense of normalcy. We want to make sure that our kids are they're physically and mentally active. We want to make sure they're good. As a coaching staff, you want to make sure we haven't seen our kids before we got back on June 22nd. We abruptly got out of school on March 12th, March 13th. So, we see our kids, and we just want to make sure we're doing things the right way, social distancing as best as possible, and, sanitizing and making sure we're spraying down the equipment as the kids use it.
In terms of the procedures being taken, you mentioned a couple of them: spraying down equipment as it's being used, maintaining physical distancing measures among your team, dividing them into separate groups for practices and for being in the weight room and so on. In terms of coming to practice and being tested the day of each and every day, what procedures are your guys going through or required to go through, either by the MHSAA, by the state, by the high school, or your staff, in order to clear them to be healthy to practice that day?
Yeah, we're doing our screenings suggested by the MHSAA, and our kids come in. They have to come in with a mask. If they don't have a mask, we do provide masks for them. We have them on site, but we're on our kids about having their own mask. In addition to that, as the kids come on campus, they scan their phones for the QR codes, and when the QR codes open up, it's a series of questions. Are you coughing? Are you sneezing? Is your temperature over 100 degrees? And, have you been exposed to one with COVID of recent? And, obviously you hope the kids all press a no. And if they say yes, then you kind of send them home and, follow up with some questions. But, we're doing the screenings with we have our thermometers there, and, we're measuring from, while social distancing, we're measuring their temperatures and doing things the right way, best of our ability to make sure that we are we're diligent about things and doing things the right way.
The Centers for Disease Control and Prevention recently released guidelines for youth sports, and includes things like limiting high fives and close contact and discouraging high amounts of direct contact until game days. Are you concerned with football being as much of a contact sport and your need to have your guys be in that physical contact in practices as you're getting closer to the season? Are you concerned that there may be further regulations coming down, or that football may not be happening in the fall because of that close contact?
Yeah, you know what? That's that's the science behind it. I will tell you this: my goal is to make sure that our kids are they're safe. Our kids and our coaches. If we're able to play football, that's a great thing. If not, we all understand what we're faced against. In regards to being able to practice, I have no idea what that looks like. Right now we're just taking it one day at a time. And we're trying to just teach techniques and make sure we're working on our skill and agility and making sure the kids are strong and conditioned. Just some things you can do. Typically what we do in the summers anyway. So, this is not different than what we've done over the past, since I've been there, past 11 years. So, we're going to continue to do that and, keep our fingers crossed that August 10th, we're allowed to play football.
Coach Ron Bellamy from West Bloomfield High School. He's their head football coach with us on the Oakland County Megacast. And Coach, you and I and Dave, you and Dave on our football broadcasts and other programming before have touched on this. You're a father first, and coaching is your side job. And parents are concerned. Families are concerned about their kids playing sports and being in close contact with people. Some are even concerned about returning their kids to school altogether. Have you noticed or have you experienced players or families that are saying we're not going to participate in football this year? And are you concerned about maybe losing more players if things continue to spike as we're seeing right now, getting closer to the season?
I have not. There's a couple kids that we have on our roster that we anticipated playing who are not out there, but that's typical in the summer, because workouts are voluntary. So some kids, they're out of town or, they may be with a different parent or whatever it may be, whatever the circumstance is. But I have not had a parent tell me my kid's going to sit out this year due to, COVID-19. I have not experienced that yet. In regards to everything else, as far as, football being displaced this year, we're following the guidelines and, we're watching the news and following Governor Whitmer and the MHSAA and whatever directive we get, we're going to roll with it, and our kids totally understand the circumstances.
Coach Ron Bellamy, the West Bloomfield High School football coach, with us on the Oakland County Megacast. Coach, you had a lot of players that moved on to college football. They're moving on to college football this fall, including but not limited to Cornell Wheeler and Makari Page that are going to the University of Michigan. You already have going into his sophomore year there, Trey Mosley at my alma mater, Michigan State. And yesterday, the Big Ten announced that all fall sports, including football, will be only played in conference. Your thoughts on that situation, and how are your guys doing in their new college experiences for those who are going in as incoming freshmen to new football teams?
Yeah, I was able to stop in Ann Arbor last week to visit Cornell and Makari just to kind of check on them and see how things were going. Things were great with them. They're just working out much like we are, and they're getting acclimated to the football program. Makari enrolled early, so he had a head start on things in January before things were shut down. So, but he feels a little bit more comfortable in Cornell, but both guys are doing well. Trey Mosley's doing well at Michigan State. Those guys are doing the same thing. Lance Dixon's doing the same thing at Penn State, and Taj Mustafa and A.J. Abbott are doing the same thing at Wisconsin. So it's pretty cool to have, a bunch of kids playing Big Ten football. And,
Coach,
go ahead.
I'm sorry. No, go ahead. Continue on.
Yeah, so checking on those guys' well-being, things are going well from that standpoint.
That's good to hear, Coach Ron Bellamy with us on the Oakland County Megacast. Your thoughts on, you're a Michigan alum, your thoughts on the Big Ten moving all sports, including football, to being only in conference in the fall?
Yeah, you understand why they made the move. I know a lot of people are saying, well, what's the difference between playing for Michigan, playing the University of Washington, and playing, Indiana? I guess what they're trying to do is they're prepared to start football, as soon as they can. And if there's any disruptions, you can kind of take the disruptions and you can finish your conference slate. So, it's one of those deals where you get it. If you really know, behind the scenes, if you know what's kind of going on, you understand why they made the moves that they did and why they made it so early. But like I said, man, you have to have a plan. You have to have, a contingency in the event that, no one knows how strong this virus is. No one knows, the length of this virus. And, we just, trust the scientists and trust science and our legislation and making sure that they put us in the best position to maintain safety.
Coach Bell, anything else before we let you go today?
I just thank you guys for, talking about this because it's a subject that is very diligent and is one that we as Americans, we love football, and we want to make sure that, we're doing things the right way to see the game. I know a lot of people are upset the way things are going and the news that they're getting, but, man, let's safety first. Let's continue to wear a mask and, take care of each other and things be back to normal, before we know it.
Yeah, hopefully we'll be able to get through this real smoothly and get back to football in the fall. Dave and I are really looking forward to another season of broadcasting Lakers football. Thank you for being with us today, Coach Bell.
All right, thank you so much for having me.
Coach Ron Bellamy with us on the Oakland County Megacast on our family of TV and radio stations. High school sports, Ronnie, are just so critical to the experience of the community here in West Bloomfield and in other communities all throughout the Oakland County area. I mean, wherever we go, especially, and I hate to just focus on football, but especially in the environment of the football stadiums on Thursday and on Friday nights. We go anywhere in the Oakland County area. We go to Lake Orion for a big game. You go to Rochester Adams for a big game, Bloomfield Hills High School, and so on, and definitely at the Swamp at West Bloomfield High School. It is a huge community gathering place. It's something that is a conversation starter for neighbors and people that maybe don't normally interact with each other. And so changing that dynamic in the fall with all fall sports, but especially with football, is going to really impact communities both in our area in Oakland County and all throughout the state and the union.
I believe Texas just announced that they would not have any high school football in the upcoming season, and Texas is a huge high school football state. So everyone is having to change what they do, but I don't even think it's so much about the game that attracts people to football. It's the traditions and the atmosphere around the game. It's the tailgating. For some reason, you don't get the same tailgating experience for a baseball game. No one's going to, if we're looking at pro sports, no one's going to Eastern Market before a Tigers game necessarily like they do a Lions game. So it's that experience and that community that brings everyone together. And that's what makes high school football so big, and that the possibility of not having that this year is going to be a change for everyone. But I think anyone who has a child that plays football understands safety first.
And it was really good to hear from Coach Bellamy, and it was great to hear previously on the program from people like Mike Kodry, the Director of Athletics in the Bloomfield Hills School District, that the emphasis is 100% first and foremost on the players and on the families and on the coaches to make sure everybody is safe. Football can happen. Football will happen eventually again, as will all other sports, but the primary focus is going to be keeping our guys safe, keeping our gals safe, keeping our coaching staff safe, and making sure that we're not contributing to the coronavirus pandemic by not taking these things seriously. And that's really good to hear, really reassuring to hear from Coach Bellamy and from other officials that are looking over our high school sports and our local sports in the immediate and into the future as we continue to work through this pandemic. Just about a minute left in today's program. That is going to do it for this week of the Oakland County Megacast. We thank you for joining us each and every day, and we will be back on Monday and all throughout next week from 10 a.m. to 12 noon right here on our family of TV and radio stations, bringing you more of your local news. We thank our guests today, former Lieutenant Governor and current President of the Small Business Association of Michigan, Brian Calley, Dr. Jamie Taweel, Internal Medicine Specialist at Grand River Medical Associates, Garry Gilbert, Journalism Professor from Oakland University, Eric Wallis, the President of Henry Ford West Bloomfield Hospital, Dave DeBoer, the Deputy Fire Marshal at the West Bloomfield Fire Department, and our last guest, Ron Bellamy. Also, a huge thank you to Jeff Cowan, our executive producer. Today was his last full day working on the program. We thank him for excellent work each and every day to bring the best possible guests and put the best possible stories forward to bring to you, the audience. And also a huge thank you to Marty Schaefer and Keith Fraley and Logan Brazzuro over at WAHS 89.5 Avondale Community Radio, as this will be the last edition of the Megacast that they will be joining us live during our regular shows for. We hope, but we'll continue to serve the communities of Auburn Hills and the surrounding areas covered by WAHS into the future. For Ronnie Dahl, I'm Tyler Keefe, thanking you for tuning in. This has been the Oakland County Megacast on a family of TV and radio stations.